Today I'm excited to sit here with one of my newer patients who's clearly one of my favorite patients already because we like to have conversations. I met this gentleman because I was treating his wife. So he was just the onlooker, watching what we do here. And that's always one of my favorite things, is when one of my patients becomes my patient because he gets to sample the goods. It's it's kind of a nice feeling that they watch what we do, the patients do, and decide, hey, I wouldn't mind letting these guys treat me too. So to start off, that's a really nice feeling, and I thank you for being a good observer, Wolf. So the reason I'm making this video and I'm including Wolf is because my videographer, who happens to be Denny, my brother, asked me yesterday would I make a video talking about ozone and the magnet. So wouldn't you know it, serendipity brought me Wolf, who I have been using ozone and the magnet upon Wolf. So Wolf, you correct me if I'm wrong on anything, but you had back pain for quite a bit of time, and that was the reason Wolf wanted to see me as a patient, because of back pain. He had gone to the chiropractor many times, and I'm going to let you tighten up my description.
I went to the chiropractor for basically 30 years.
Oh, see, it's longer than I knew.
At the end in Long Island on a weekly basis, every Wednesday. And we got the invitation here. I got the injection on Friday, twice 15 minutes on the magnet. And Friday night, the first night I slept through without any pain, very comfortable. So I'm now on the first full week on 30 minutes, and I have to say I feel great, absolutely great. I can do things which I couldn't do for a long time. I can bend down, I can tie my shoes, I can do anything basically. I mean, not anything, but right. I'm already 90% better than all.
You're healing, and that's what we love
Yep.
to know. That is why I call that little guy my chiropractor. I'm going to put a white lab coat on it. So now let's go to a little bit of nuts and bolts. That's really nice of you to share, Wolf. But so on a nuts and bolts level, why does this work so well? Why do the two things synergize? And the reason is the types of treatment that I deal with are based on electricity and voltage. So as I've explained to Wolf and some of my other patients, if I could put special glasses on someone, and this is actually funny because I think I told your wife this, I said, if I could put special glasses on you and you could look at each person electromagnetically, all you'd see is electrons and neutrons. She goes, oh, those kind of glasses exist? I don't know if it was your wife or someone else, but the point is, if you could put on, just like the Navy SEALs, Special Ops use infrared glasses at night or whatever they're using, they can see things. So if you could look at your body with special electromagnetic glasses, you'd see just waveforms, electrons, protons, and neutrons. So illness is caused by the voltage across cell gradients becoming positive. So these systems, like the electromagnetic impulse system, ozone, which has a free electron to donate, or ionized oxygen or monatomic oxygen, they synergize because they're all doing delivery of electrons, and delivery of electrons causes the millivoltage to drop, and negative millivolts leads to healing. So these two entities synergize because, for unknown reasons, maybe it's some kind of quantum physics principle, the magnet tends to supercharge other healing delivery systems, whether it's even medication or drinking water. So in essence, that is why we have seen the synergy, and our friend here is a great example of clinical application of these principles. A smiling patient leads to a smiling doctor, and we just have lovely conversations because my chiropractor is working on Wolf all the time.
What?
Thank you.
It's a great feeling.
Thank you.